6 supplements to help lower cholesterol. So, what's really happening with high cholesterol? As the heart pumps oxygen-rich blood through the arteries to nourish the body, certain lifestyle factors like poor diet, smoking, and lack of exercise can damage the inner walls of these arteries. This damage causes inflammation and the formation of small lesions or cracks. LDL cholesterol then accumulates in these areas, attempting to repair the damage, much like a Band-Aid. Though cholesterol's role is reparative, without lifestyle changes, ongoing damage leads to the buildup of plaque. This plaque is a mix of cholesterol, calcium, and other substances, which hardens over time, severely narrowing the arteries and impeding blood flow. If left unchecked, high cholesterol can lead to critical health issues, regardless of age. This video will cover 6 key supplements that can help lower cholesterol levels and improve your overall cardiovascular health. Remember, this video is for educational purposes only, and it's crucial to consult with your healthcare provider for personalized medical advice. 1. Berberine. Berberine is a special substance found in certain plants like the barberry shrub, golden seal, and Oregon grape. It's been used for a long time in Chinese and Ayurvedic medicine. Recent research shows that berberine is really good at managing fats in our body, which means it can lower total cholesterol, bad cholesterol, LDL, and fats called triglycerides, while possibly raising good cholesterol, HDL. Berberine does its job by blocking a specific enzyme, PCSK9. This makes the liver put more receptors on its surface that grab and remove LDL from our blood, similar to how some cholesterol-lowering medicines work. Also, berberine can help people with type 2 diabetes or metabolic syndrome, a group of conditions that increase the risk of heart disease, by making the body better at using insulin and lowering blood sugar levels. However, berberine can mess with how other medicines work, especially those for diabetes, high blood pressure, and heart disease. That's because it can change the way our body processes these medicines. So if you're thinking about taking berberine, especially if you're already on medicines for ongoing health issues, it's really important to talk to a doctor first to make sure it's safe for you. 2. Psyllium Husk. Psyllium husk is a type of soluble fiber that comes from the seeds of the Plantago ovata plant, which is often grown in India. It's known for being really good for your stomach and helping keep your heart healthy by managing your cholesterol levels. When you eat psyllium husk, it soaks up water in your gut and turns into a thick substance. This is great for your heart for a couple of reasons. Mainly, it grabs onto fats and bile acids in your intestines. Your liver makes these bile acids using cholesterol. When psyllium husk grabs the bile acids, your body gets rid of them. Then, your liver has to use more cholesterol to make new bile acids, which lowers the cholesterol in your blood. This is especially good for reducing bad cholesterol, LDL, which can lead to heart problems if there's too much of it. Also, psyllium husk slows down how fast your body digests and absorbs fats and cholesterol. This helps keep your cholesterol levels healthier. You can find psyllium husk in different forms, like whole husks, powder, or capsules. It's really important to drink a lot of water with it so it can do its job properly. The amount you should take depends on what you're using it for, but for cholesterol, people usually take 5 to 10 grams with their meals once a day. Psyllium husk is generally safe for most people, but sometimes it can cause bloating, gas, or stomach cramps, especially if you're not used to it or don't drink enough water with it. Since it can also mess with how your body absorbs medicines, you should take it either 1 hour before or 2 to 4 hours after you take your medication. Before you start taking psyllium husk, you should talk to a doctor or healthcare provider, especially if you have stomach problems, are pregnant, or are taking other medicines, to make sure it's okay for you. 3. Red yeast rice. Red yeast rice is a food and medicine that's been used in China for ages. It's made by adding a special kind of yeast called Monaskis purpureus to white rice. This process turns the rice red and makes it contain certain ingredients, one of which is monocolin K. Monocolin K is known for its ability to lower cholesterol, which is why people are interested in it. Monocolin K works just like a medicine called lovastatin, which doctors prescribe to help lower cholesterol. Both monocolin K and lovastatin slow down an enzyme in the liver that makes cholesterol. This means there's less bad cholesterol, LDL, floating around in your blood. Many studies say that red yeast rice can lower bad cholesterol in people who have too much of it. It might also lower triglycerides, another type of fat in your blood, and slightly increase good cholesterol, HDL. This makes red yeast rice a popular choice for people who want to manage their cholesterol naturally. The right amount of red yeast rice to take can change a lot. It depends on how much monocolin K is in the product. Usually, studies use doses between 1,200 and 2,400 milligrams a day. But the amount of monocolin K in over-the-counter products can be different from one brand to another, because supplements aren't as strictly regulated as medicines. Even though red yeast rice can help lower cholesterol, it can have some of the same side effects as lovastatin and other statin drugs. This includes muscle pain, liver problems, and kidney issues. These side effects are usually not as strong with red yeast rice as they are with higher doses of statins, but they can still happen, especially if you take a lot. It's really important to talk to a doctor before you start taking red yeast rice, especially if you're already on statin drugs, because mixing the two can increase the chance of bad side effects. Also, people with liver problems, pregnant women, and breastfeeding moms should stay away from red yeast rice unless a doctor says it's okay. In places like the United States, there have been some rules put in place about red yeast rice products that have a lot of monocolin K in them. This is because they're pretty similar to prescription drugs. This means there's a lot of difference in what's actually in these products, so talking to a healthcare provider before using red yeast rice is even more important to make sure it's safe and will work for you. If you find these tips helpful, we encourage you to show your support by liking this content, subscribing to our channel, and enabling notifications for the latest health and nutrition tips. 4. Niacin, or vitamin B3, is super important for turning food into energy and keeping our cells healthy. You can find it in lots of foods like meat, fish, nuts, and grains, and it's also available as a supplement. Niacin works in a few ways to deal with cholesterol. It can stop a certain enzyme from making too much fat in the liver, which means less bad cholesterol, LDL, and very low-density lipoprotein, VLDL, in your blood. Niacin also helps increase good cholesterol, HDL, by up to 35%. This is great because HDL helps clean up other cholesterols from your blood, reducing the risk of heart problems like artery clogging. Studies have shown that niacin can lower the bad LDL cholesterol and fats while boosting the good HDL cholesterol. This makes it a good choice for people trying to keep their cholesterol in check or lower their risk of heart disease. Sometimes doctors even use niacin with other cholesterol medicines for a better effect. Niacin comes in different types, like immediate release, sustained release, and extended release. Immediate release niacin might cause a hot, itchy feeling called flushing, but is less likely to mess with your liver. Extended release types are made to cut down on flushing, but might be a bit riskier for your liver. While niacin can be good for managing cholesterol, it's not free from side effects. The flushing from niacin can be pretty uncomfortable, but you can lessen it by taking aspirin or a different kind of niacin. If you take a lot of niacin, you might face more serious issues like liver problems, stomach troubles, high blood sugar, or even gout. That's why if you're taking a lot of niacin, you need a doctor to keep an eye on your liver. Because niacin can have both good and bad effects, you should be really careful about using it, especially if you're at high risk for heart problems or already taking cholesterol drugs. It's super important to talk to a doctor before starting niacin to figure out the best dose and type for your health situation. 5. Garlic. Garlic is a popular flavor booster in foods all over the world, but it's also known for being good for your heart. Garlic has sulfur-containing compounds, like allicin, which you get when you chop or crush garlic. These compounds are thought to be why garlic might help keep your heart healthy. Scientists aren't exactly sure how garlic works to affect cholesterol, but they have some ideas. They think garlic might stop the liver from making too much cholesterol, help get rid of bad cholesterol, LDL, in the blood, and stop bad cholesterol from sticking to the walls of arteries because of its antioxidant properties. Studies have had mixed results, but some show that garlic can slightly lower the bad cholesterol and overall cholesterol, especially if your cholesterol is high to begin with. The amount it can lower cholesterol isn't huge, and it seems to work best in the short term, like 1 to 3 months. The impact of garlic might change based on whether you're using fresh garlic, garlic powder, or garlic supplements, how much you use, and for how long. Besides possibly lowering cholesterol a bit, garlic might also help lower blood pressure if it's too high and reduce the risk of blood clots and stroke. It's also thought to protect your arteries from damage because of its antioxidants. You can eat garlic fresh, cook with it, or take it as a supplement, like garlic oil, powder, or capsules. Eating garlic as part of your food is generally safe and can be done often. However, if you're thinking about taking garlic supplements, you should be a bit careful. They can cause stomach upset, bad breath, body odor, and sometimes allergic reactions. Also, garlic supplements might not mix well with some medicines, like blood thinners or HIV drugs. 6. Green tea. Green tea extract comes from the leaves of the green tea plant and is full of antioxidants, which are really good for your health. The most important antioxidant in green tea is called EGCG, and it's thought to be the main reason. Green tea can help keep your heart healthy and lower bad cholesterol. Scientists believe green tea extract helps in a few ways. First, it might stop your body from taking in too much cholesterol when you eat, which means less bad cholesterol ends up in your blood. It also might help increase the good cholesterol, HDL, making your heart healthier. Plus, green tea extract can make your blood vessels work better, lowering your risk of heart problems and high blood pressure. Studies on whether green tea extract lowers cholesterol have had mixed results. Some research says it does help by lowering total and bad cholesterol levels, which is great for your heart. But other studies didn't see much change. This means the effect of green tea on your cholesterol might depend on things like your genes, what you eat, and how you live your life, as well as how much green tea extract you take. Even though we're not 100% sure about its effects on cholesterol, drinking green tea or taking its extract can still be good for you. It can help manage your weight and might even reduce the risk of diabetes. You can find green tea extract in pills, liquids, and tablets. The amount people take in studies varies a lot, but they usually use between 200 to 800 milligrams of EGCG per day. However, taking too much can be bad for your liver, so it's important to not go overboard and to watch out for any signs of trouble. While green tea and its extract are usually safe, taking a lot in supplement form can be risky for some people, especially if you have liver problems. Pregnant women and people taking certain medicines should be careful too. Since green tea extract has caffeine, it might also cause issues like feeling jittery, having trouble sleeping, or a faster heartbeat, especially if you're sensitive to caffeine. If you don't want caffeine, you can choose decaffeinated green tea extract instead. Green tea extract could be a helpful way to make your heart healthier and lower cholesterol. Like with any supplement, it's a good idea to talk to a doctor before you start taking it, especially if you already have health issues or take other medicines. Thank you for watching 6 supplements that will help lower cholesterol on Healthy Vibrance. Don't forget to like, subscribe, and turn on notifications for more health-related content. See you in the next video.